Hello everyone, so let's welcome to the session of common mistakes and commonly asked MCQs of anatomy. The common MCQs which you should not fail to make any mistake in these common MCQs targeted for your NEET PG 2021. So this is the series which is started on the Let's Crack NEET PG platform. So let's start with the session. Myself Dr. Monalisa. And before starting the session, I would like to tell you about myself Dr. Monalisa, and I have got 8 years of teaching experience for the past 8 years, and I have done my MD Anatomy from Armed Force Medical College, Pune. This is my referral code ANAT10 which can be used by you if you want to take the subscription of Unacademy, or you want to avail the opportunity of being on the free platform of Unacademy. You want to see free sessions of mine or any other educator, you can use this code ANAT10. So my dear aspirants, what I want you to tell that let us first focus on the common mistakes. So before starting the commonly asked anatomy MCQs targeting NEET PG 2021 examination, I would like to focus on the common mistake which is made by the aspirants during the examination. Time duration, the first thing is that time duration must be taken care of. Time duration is very, very important. And the second thing is, don't be in hurry while reading the MCQs. Read it properly. Sometimes you are knowing the answer, but because of hurry you make certain mistakes. The third thing is that don't waste your time if you are not getting in or you are getting stuck for any tough or tricky MCQs. So just move on. Okay. Why? Because if you will waste time on just solving one MCQs, maybe that will affect the other MCQs. So what is the target? To solve many MCQs, all the MCQs, and keeping in mind the negative marking also, you have to solve it. So time management is very important. Don't get stuck if you are not able to solve any of the tricky questions. So let's start with the session. Before that, few important points about the platform of Unacademy. So firstly, I would like to tell you about the Telegram group, that is Let's Crack NEET PG Telegram group, where the updates, links and all educators of Let's Crack NEET PG Unacademy group is there. You can ask relevant doubts from the educators in this group, and also you will get the link of the session which is upcoming, both of the free sessions and also of the plus platform. Now my dear aspirants, ask a doubt. So how you are going to ask a doubt? So for asking a doubt, first click on doubt on the screen button. Now take a picture or choose the doubt from the gallery. What you can do, you can crop it. You can crop the image, highlight the specific question which you want to get it answered, and thereafter select the correct subject to which that question belongs. So this is how you can ask a doubt. Now thereafter, I would also like to tell you about the Unacademy app. So how you are going to download the Unacademy app. This is for the first time users of Unacademy. So what you have to do, you have to download the Unacademy app from the Play Store. Then you have to find your goal. So what you will find your goal as NEET PG. Your goal will be NEET PG, and thereafter what you have to do, you have to type my name or any of the educators whose class you want to follow or see. So write down Dr. Monalisa. Thereafter you will find many free sessions and also updates about the plus courses. So if you want to see the free sessions, just use the code ANAT10 and then you will be able to view the free session. So free live classes on Unacademy platform is there, which can be targeted by you so that you can be the part of free sessions. Unlock code is ANAT10. Now my dear aspirants, as I told you already, we have targeted 200 anatomy MCQs directly related to NEET PG 2021 examination, which is very, very important to be revised before the examination so that you can get a better rank. So for that, we have already covered 7 part of it. Altogether, what I told you, we have got 10 sessions of anatomy MCQs, 200 anatomy MCQ series. So still we are remaining with the 3 sessions. So these 3 sessions will be done on the platform of Unacademy free platform. That is on 17th August, Tuesday, 6 and 7 p.m. 2 sessions are there. On 18th August, that is Wednesday, only 1 session is there, that is 6 p.m. session. So we will complete all the 200 anatomy MCQs targeting NEET PG entrance examination. You have to download the Unacademy app and then use the code ANAT10. I also want to give you the information of Wednesday. Wednesday is a day where so many free sessions come up on the platform of Unacademy. On Wednesday, one session is 200 anatomy MCQ series. That is the last session of 200 anatomy MCQ series. Thereafter, I want to give you the information of one more session which I am taking at 7 p.m. So this is also on the platform of Unacademy. So download the Unacademy app and get oriented in this session, you should join in this session live by using the code ANAT10. It is an orientation program which I am taking, and it's for the next 10 clinical anatomy MCQ discussion. So mainly I am targeting Lady Hardinge Medical College students, but all the interested student can join me for the orientation of next 10 clinical anatomy MCQs. So join me on 18th of August 2021, 7 p.m. Okay. The first time user can use the code ANAT10 for targeting the session. Now let's move on to certain special features which is lying on the platform of Unacademy. So interactive live session is a key to success. So there is many sessions simultaneously going on the platform of Unacademy, where you can be the part, and there you can interact live with the educators. Polls are conducted among the learners that will give you a better idea where do you stand in the masses. Raise your hand while the live session is going on and ask your doubts and get it cleared by the educator who is taking the live session. Never miss a class. So never miss a class. This is the key factor which is provided on the platform of Unacademy if you follow the educator. For example, if you have seen one of my session and you liked my session, you want to follow my session, so just follow me. When you follow me, what happens, you will get the updates of upcoming courses of mine and also the updates of the special free session. After the completion of the session, what you can do, you can take the lecture notes by downloading the PDF. Anytime, anywhere, be connected on the special free session. Don't miss any of the special sessions on the Unacademy platform. Now, I also want you to tell, subscribe, like and share. Let's crack NEET PG platform. And if you want to take the plus subscription of Unacademy, use the code ANAT10. So, my dear aspirants, use the code ANAT10, get 10% discount and take the subscription of Unacademy. And if you want the subscription of Prep Ladder, also go for Iconic subscription. Okay, so let's start with the important MCQs. What I want, that the most commonly asked anatomy MCQs should not be missed out. So this session is targeted on that point. Question number 1. Marked area is related to which of the following structure, whether it is liver, second part of duodenum, stomach or spleen. As you can see in the diagram, the arrow marked area is shown, green color arrow marked area is highlighted here as you are seeing. So you have to tell me which of the following structure is related on this green color arrow marked area. This was the MCQ which has been asked in AIIMS entrance exam 2019. And so I am targeting this. This is very important. So let's solve this MCQ. For solving this MCQ, the hint which is provided is, this is a diagram which is not only showing the kidney, but it is also showing the suprarenal glands. So by the shape of suprarenal glands and inferior vena cava location, we can know which is the right and the left kidney. So here the question is targeted onto the left kidney anterior surface. So see here, same diagram, what you can see, semilunar shape is the shape of left kidney, and triangular cap like shape is of the right suprarenal gland, which is sitting over left and right kidney respectively. Also inferior vena cava is lying closer to right kidney as compared to left kidney. So these are the hints which we can see and target in identification of right and left side kidney. Thereafter, what is very important for us to know is the area of anterior aspect of right and the left kidney, which is related with different areas. So the targeted area which has been asked in this MCQ was of left side anterior aspect, and we can see the correct answer is spleen. This area is spleen. So this whole anterior area of the left kidney is related to the spleen. Thereafter, you can see adjacent to it we have got the stomach gastric area related. Overlining the upper aspect we have got on both the sides suprarenal area. So on both the side we have got suprarenal areas related. And in case of left kidney, also close to the splenic area we have got the pancreas relation. Lower to this area we have got the colic and the jejunal areas. We have got the colic and that of jejunal areas related. So this is the structure and different areas I have outlined so that you can have the idea of relations of the structure on the anterior aspect of left kidney. Now moving on to the relations of the structures onto the right hand side. So a greater area of right anterior aspect is covered and related by hepatic area. On the medial aspect towards the hilum, the area which is related is of duodenal area, as you can see in the diagram, and below the duodenal area inferior aspect we have got the colic area. So yes, these are the relations of right and the left anterior aspect. So yes, clearly now we are knowing that the correct answer for here should be, so as we have come up with the description, and we can say that this is the left kidney, and this area, as just now we have seen, this is area is related to the spleen on the anterior aspect of the left kidney. Let's move on to the second MCQ. Which of the following arteries is not a branch of the first part of maxillary artery? Okay, which of the following arteries is not a branch of first part of maxillary artery? Options are greater palatine artery, middle meningeal artery, deep auricular artery, and inferior alveolar artery. Okay, so coming to the answer, so for answering this MCQ, I would like to give you the branches of each part of maxillary artery. Now see here, maxillary artery is one of the terminal branch of external carotid artery, and its entire course is divided into three parts. As you can see, before lateral pterygoid muscle, it's the first part, and lateral or within the lateral pterygoid muscle we have got the second part, and beyond lateral pterygoid muscle towards the pterygopalatine fossa we have got the third part of maxillary artery. In this diagram we can see the maxillary artery first part is giving 5 branches: middle meningeal, anterior tympanic, deep auricular, accessory middle meningeal, and inferior alveolar artery. 5 branches. From the second part, all the muscular branches are there. From the second part, we have got all muscular branches, that is the buccal, temporal. Okay, so I will come up with the branches of each part. We have got mainly muscular branches, pterygoid, masseteric, and buccal branches. And from the third part, we have got 6 branches: posterior, superior, alveolar, infraorbital, sphenopalatine, greater lesser palatine, pharyngeal arteries. All these are the branches from the third part of maxillary artery. So quickly write the name of the artery so that you can revise, because it's very important that you should know branches from each segment of maxillary artery, first, second, and third. So let's write it. Branches of maxillary artery. Branches of maxillary artery. So the branches of maxillary artery is following, as you can see here. Branches from the first part of maxillary artery. Branches from the first part of maxillary artery. The branches from the first part of maxillary artery is following. So we have got 5 branches from the first part. The name of that arteries are deep auricular artery, anterior tympanic artery, middle meningeal artery, accessory middle meningeal artery, and inferior alveolar artery. Okay, these are the 5 branches from the first part. These are the 5 branches from the first part. Now let's move on to the branches of the second part. Now branches from the second part. Write down branches from the second part of maxillary artery. So as I told you, all the branches from the second part of maxillary artery is muscular. The branches of second part of maxillary artery is muscular, and the name of the arteries are, it gives deep temporal arteries, it gives buccal arteries, it gives masseteric arteries, means neighboring muscles is muscular arteries are given to the neighboring muscle. It also gives branch to pterygoid branches. It also gives pterygoid branches or pterygoid arteries. So these are the 4 muscular branches given by the second part of maxillary artery. Now coming to the third part. So third part is giving how many branches? The third part of maxillary artery. The third part of maxillary artery. Third part of maxillary artery is giving 6 branches. So the branches are, write down the name, the branches are posterior superior alveolar artery, infraorbital artery, pharyngeal artery, artery to pterygoid canal, sphenopalatine artery, and descending palatine artery. So done. These are the branches, 6 branches from the third part of maxillary artery. So yes, clearly we are knowing that after this description, we are clearly knowing that greater palatine artery is not a branch of greater palatine artery is not a branch of first part of maxillary artery. It's a branch from third part of maxillary artery, greater palatine artery. Okay, done with this. So yes, now let's move on to the next, that is question number 3. Guyans canal contains which of the following nerve? Guyans canal contains which of the following nerve? So whether it is ulnar nerve, radial nerve, medial nerve or anterior interosseous nerve. The correct answer is ulnar nerve. Actually, Guyans canal is a fibro-osseous canal or a tunnel which is located on the medial aspect of the hand, and ulnar nerve and ulnar artery traverses through it. So let me show you this, then I will also explain the boundaries of it. But here in this diagram you can see the location of Guyans canal has been opened up, and we can see ulnar nerve is passing through it. Also here the cut end of ulnar artery is there. So actually ulnar artery and ulnar nerve is passing through this fibro-osseous canal which is called as Guyans canal, and you can see here these are the transverse carpal ligament on which the Guyans canal is resting, or the ulnar nerve ulnar artery is traversing superficial to it. And we can also see it is quite correlated with the bones hamate and the pisiform as shown in the diagram. So let me write the boundaries again, we will come to this diagram. So all of you write few points about the Guyans canal. Guyans canal. So Guyans canal is fibro-osseous canal. Guyans canal is fibro-osseous canal, or you can say it is a fibro-osseous tunnel located on medial side of hand, and the structures traversing, which structures is traversing? Ulnar nerve and ulnar artery is traversing through Guyans canal. Two structures, ulnar nerve and ulnar artery, is traversing through Guyans canal. So it is also important for you to know the boundaries. So next, write down the heading, that is the boundaries of Guyans canal. So I would like to give you certain important points about the boundaries. So heading, boundaries of Guyans canal, and then we will again see that diagram. So the boundaries of Guyans canal is following, write down. Roof. Roof is formed by, actually there is a palmar carpal ligament which is covering it. So roof of Guyans canal is formed by palmar carpal ligament, also covered by one of the muscle, that is the muscle that is the example of panniculus carnosus muscle. So that muscle is an example of muscle lying in superficial fascia. So Palmaris brevis muscle. Also hypothenar connective tissues is covering it. So these structures are forming the roof of Guyans canal. Let's move on to the floor. Floor of Guyans canal is formed by following structure. As I have shown you in the diagram, it is resting over transverse carpal ligament which is also called as flexor retiniculum. So floor is formed by, these three structures are forming roof. Now coming to the floor is formed by transverse carpal ligament, floor is formed by transverse carpal ligament, pisohamate and pisocarpate ligament, pisohamate and pisocarpate ligament, pisometacarpal ligament, pisometacarpal ligament, got it? Also floor is formed by tendon of flexor digitorum profundus and opponens digiti minimi. Opponens digiti minimi. Opponens digiti minimi. Got it? So yes, we have done with the roof and the floor. Now let's move on to the medial and lateral aspects. So yes, so let's move on to medial and lateral aspects. So here itself I would write medially it is related to which structure, and laterally Guyans canal is related to which structure. So the answer is medially it is bounded by pisiform, bone, flexor carpi ulnaris and abductor digiti minimi muscle. On lateral aspect, it is bounded by hook of hamate. Hook of hamate, that is mainly forming its lateral aspect, hook of hamate. Okay, so yes, now let's see the diagram once again. So can you see here, on either side it is bounded by pisohamate and it is bounded by hamate and the pisiform, and it is resting over this green color ligament is the transverse carpal ligament, which is covering, which is the forming the floor, and superficial to it the structure which is lying, which has been dissected out here, is the volar carpal ligament. Volar carpal ligament, this is the location of Guyans canal. Let's move on to the next. All muscles of the tongue is supplied by hypoglossal nerve except. So actually this is commonly asked MCQ, and it's very important for you to know that actually all the muscles of the tongue is getting innervation from hypoglossal nerve except palatoglossus. So palatoglossus muscle is correct. Why? Because palatoglossus muscle is getting innervation from which nerve? The answer is it is getting innervation from vagus nerve via pharyngeal nerve plexus, vagus nerve. So see here, only palatoglossus is the muscle which is getting innervation from vagus nerve. All other tongue muscle is getting innervation from hypoglossal or 12th cranial nerve. Question number 5. Which of the following is actually lateral cutaneous branch of intercostal nerve innervating medial aspect of the arm? So we have got 4 options: intercostobrachial nerve, superior lateral cutaneous nerve of arm, inferior lateral cutaneous nerve of arm, and medial cutaneous nerve of arm. So yes, which nerve is it talking about? Intercostal nerve innervating the medial surface arm. The correct answer is intercostobrachial nerve. Actually, intercostobrachial nerve is lateral cutaneous branch of second intercostal nerve. So what is intercostobrachial nerve? Intercostobrachial nerve is lateral cutaneous branch of second intercostal nerve, and this nerve is forming communication with that of medial cutaneous nerve of arm. So only it is innervating medial aspect of the arm, which is mentioned in this MCQ. See here. So here you can see that intercostal nerves are radius. Can you see intercostal? These are all intercostal nerves, which is these are all intercostal nerves as shown in the diagram, and these intercostal nerves are going towards the arm. In this you can see here the intercostal nerves which has got which can come from the thorax region, and it can communicate with the nerves on the medial aspect. So second, in the second intercostal nerve branch is intercostobrachial nerve. There is a more clearer diagram. Okay, so this is how it is communicating, but I will show you another diagram which is a cadaveric image where you can appreciate the branch of ICBN is intercostobrachial nerve. ICBN means intercostobrachial nerve, and this intercostobrachial nerve exactly shown T2 level. This is the nerve, and it is forming a communication between medial cutaneous nerve of arm. Let's move on to the next. All are branches of femoral nerve except. So we have got saphenous nerve, lateral cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, and nerve to sartorius. So according to you, which is the correct answer, which is not the branch directly from femoral nerve? The correct answer is lateral cutaneous nerve of thigh, lateral cutaneous nerve of thigh. Actually, lateral cutaneous nerve of thigh is directly a branch of lumbar plexus. It is not a branch of femoral nerve. Important branches of femoral nerve has been shown in this flow chart. Femoral nerve arises from L2, L3 and L4, that is dorsal division of the ventral rami of L2, L3 and L4. It is giving branch to nerve to pectineus, iliacus. Then it divides into posterior division and anterior division. My dear aspirants, from the anterior division, it is giving innervation to one muscle, sartorius, and it is giving two cutaneous nerve. One is medial cutaneous nerve of thigh, the other is intermediate cutaneous nerve of thigh. When we talk about posterior division, it is giving innervation to quadriceps femoris muscle, that is rectus femoris, vastus medialis, lateralis and intermedius, and it is giving only one cutaneous nerve, which I am highlighting here, that is called as saphenous nerve, supplying skin on the medial aspect of the leg and also till the level of great toe. So yes, so in this diagram we can clearly see that lateral cutaneous nerve of thigh is not a branch of femoral nerve. So lateral cutaneous nerve of thigh, now if you will see the lateral cutaneous nerve of thigh or the lateral femoral cutaneous nerve, it's a branch from lumbar plexus. It's directly the branch from lumbar plexus. Yes, moving to the next. Lateral part of superior ramus of pubis form which of the following structure? Question number 7. Options are iliopubic eminences, pubic tubercle, pectin, pubis, anterior inferior iliac spine. So according to you, which is the correct answer? Lateral aspect of superior ramus of pubis. The correct answer is pectin pubis. Actually, when we talk about pectin pubis, it's a ridge. Pectin pubis is a ridge lying on the superior ramus, and exactly this is connecting, this is extending from pubic tubercle to that of the arcuate line. So I would like to show you a diagram. So it is called as pectin pubis is the lateral superior ramus of pubis forming a connection between the pubic tubercle to that of arcuate line. So let me show this diagram. Let me slightly highlight it so that it will be clear to you. Yes. So what you can see, this is the pectin pubis or pectineal line. Okay. And you can see here, this is the superior ramus. So from the superior ramus, this is the superior aspect, a line is extending, that is called as pectin pubis, and from here it is getting continued here, as you can see in the diagram, which I am showing with the darker pink color. Okay, it is continuing here, and this continuation is with the arcuate line, Let's move on to the next MCQ. Palmaris longus muscle tendon is a guide to which of the following wrist? Which of the following nerve at the level of the wrist? Whether it is anterior introosseous nerve, posterior introosseous nerve, median nerve, or the ulnar nerve. We have got 4 options and you have to mark the correct answer. Palmaris longus tendon is a guide to which of the following nerve? Okay. Anterior cutaneous, posterior, median, or ulnar. The correct answer is C, that is median nerve. Let me show you a diagram for it. So if you want to block the median nerve, you can see here median nerve block, and we can see here the muscle tendon which is used as a landmark is, let me use a green color for it. This muscle tendon has been used as a landmark, and this is palmaris longus tendon. Palmaris longus tendon muscle is passing just superficial to median nerve. If we will see the flexor retiniculum, palmaris longus muscle is, this is PL, palmaris longus muscle, which is forming just superficial, and below it lies the median nerve. So it is used as a guide for median nerve. Another diagram which is a cadaveric image which will clear your doubt. So clearly you can see here, this is the muscle tendon of palmaris longus muscle. What you can appreciate, the palmaris longus muscle tendon is diverging as it reaching towards the, it is diverging here, and it diverges and forms palmar aponeurosis. It is diverging and forming the palmar aponeurosis. So it is forming palmar aponeurosis, PA, and this tendon, and just below this tendon you can see deep to it the structure which is traversing, which I am using yellow color. This is the median nerve. The structures traversing is the median nerve. Okay, now let's move on to the next. Superior border of arrow mark structure formed by. Superior border of arrow mark structure is formed by. Can you see black color arrow mark structure or area? So just tell me which of the following structure, whether it is caudate lobe, hepatic artery, bile duct, or inferior vena cava, which is forming the superior border of arrow mark structure. Actually, the structure which you are seeing is the foramen of Winslow, which is forming communication between greater and lesser sac, and it is important for you to know the superior border of this structure is formed by. The correct answer is A, that is caudate lobe. Caudate lobe is the correct answer. Let me show you a diagram. So this is a diagram. This is a schematic diagram. You can see the location of epiploic foramen, and its boundaries are superiorly it is bounded by caudate process of the liver, inferiorly by the first part of duodenum, posteriorly by inferior vena cava, and anteriorly lies the free margin of lesser omentum. And the free margin of lesser omentum will contain 3 structures: portal vein, hepatic artery, and bile duct. If you want to know the relation of these 3 structures, so bile duct and hepatic artery is anterior, portal vein is lying posterior. In this also, bile duct will lie right hand side of the hepatic artery. So we have got 3 structures: hepatic artery, bile duct, and portal vein in the free margin of lesser omentum forming anterior boundary. Now moving on to the 10th number MCQ. All of the following muscles are supplied by the structure marked in the image except. So options are sternothyroid, sternohyoid, thyrohyoid and omohyoid. So we can see here 4 options are there and you have to identify the arrow marked nerve. So which nerve is it this and which muscle is not supplied by this nerve? Actually, if I highlight this diagram clearly, you can see this nerve loop is asked and this nerve loop is ansa cervicalis. This nerve loop is ansa cervicalis, which is lying on the anterior wall of carotid sheath, and it is supplying all the infrahyoid muscle. All the infrahyoid muscle except, it is supplying all infrahyoid muscle except thyrohyoid. Thyrohyoid is not supplied by ansa cervicalis, it is supplied by C1 nerve root, which is also carrying the fibers of hypoglossal nerve. So C1 nerve root carrying communications from the hypoglossal nerve is the nerve supply of thyrohyoid muscle. Rest all omohyoid, both the inferior and superior belly of omohyoid, sternohyoid and sternothyroid is getting innervation from ansa cervicalis. Let's see another cadaveric image where I want to show you the ansa cervicalis location. As I have told you, ansa cervicalis location is on the anterior aspect of carotid sheath. So this is the loop which you are seeing. This is inferior and superior root of ansa cervicalis. It is resting over carotid artery. This is the carotid artery, common carotid artery. It is also having, as we know, in the carotid sheath we have got vagus nerve. So this nerve which you are seeing, which is written V, this is the vagus nerve. So this is the vagus nerve. So vagus nerve, and also the lateral structure which you are seeing here is the internal jugular vein. So internal jugular vein, vagus nerve, common carotid artery, and the structure which is traversing on the anterior aspect of the carotid sheath is ansa cervicalis nerve loop, which is written by SRIR, superior root of ansa cervicalis and inferior root of the ansa cervicalis, supplying all infrahyoid muscle except thyrohyoid. Also in this diagram, the superior and inferior belly of omohyoid has been shown. This is the omohyoid muscle. You can see here directly here in the diagram from the ansa cervicalis, you can see clearly it is getting innervation. Superior inferior belly of omohyoid is getting innervation from the ansa cervicalis. So done with this. Now before that I want to show you this diagram. This is a schematic diagram showing ansa cervicalis. Here you can see thyrohyoid muscle, one of the infrahyoid muscle, getting innervation from C1 nerve root carrying the fibers of hypoglossal nerve. C2 and C3 is forming lower root, C1 is forming the upper root and supplying following muscles: sternohyoid, sternothyroid and 2 bellies of omohyoid muscle, but not thyrohyoid. Now, before ending the session, I would like to tell you about my upcoming free session. So, be the part of this upcoming session, highly beneficial for targeting the NEET PG exam. Download the Unacademy app from the Play Store, find your goal as NEET PG, and thereafter what you have to search, Dr.Monalisa special free sessions. You will get the link of all my sessions. Also the link of my upcoming session link is provided in the Telegram group of Let's Crack NEET PG and also in the Telegram group of Unacademy NEET PG. So you can get the link of my session, but if you search, you will download the Unacademy app. If you are going to use the see the session in the mobile or in the laptops and all, you can directly go through the link provided. So use the code ANAT10 if you are using the Unacademy app for the first time. Firstly, you have to find your goal, NEET PG, search Dr.Monalisa, then use the code ANAT10 if you want to see the free session. If you want to take the plus subscription, again you can use this code for 10% discount. Live free sessions on the Unacademy platform. So I would like to share the timetable of my upcoming and give you the information about my upcoming session. So I am going to take sessions on 17th and 18th. So these 3 sessions are actually the remaining part of the 200 anatomy MCQ series which I have done. Previous one you can see on the YouTube's Let's Crack NEET PG, but these 3 sessions will be provided on the Unacademy app, that is 8th, 9th and 10th, Unacademy app and platform. Download Unacademy app, use the code ANAT10 and then be the part of these sessions on 17th 6 p.m. and 17th August 6 p.m. and 7 a.m. and on 18th 6 p.m. Again, there is a very important session on the 18th August, that is Wednesday. So on Wednesday, there are so many special free sessions on the platform of Unacademy. So on 18th August, Wednesday, orientation for the next and clinical anatomy MCQ discussion is done for the Lady Harding Medical College students. So if you want, you can join this session. This session is exactly on the 7 p.m. I will narrate important clinical MCQs and I will tell you how to solve this MCQs, and on this basis only from the 8 p.m. there will be a session of test which is conducted for the students who want to participate. So the link will be provided in the group and you can be the part of this orientation of next and clinical anatomy MCQs exactly 18th August 7 p.m. Use the code ANAT10 to unlock the sessions. Before ending the session, let me tell you about the important benefits of Plus subscription. You can access both live and recorded version. So simultaneously you can access both live and recorded versions, and what is important that so many sessions are there on the platform of Unacademy Plus platform, all 19 subject structured in a targeted way so that आप नेक्स्ट टारगेट कर सकते हो, नीट पीजी टारगेट कर सकते हो, यूनिवर्सिटी प्रॉफ एग्जाम ऑफ एमबीबीएस कोर्स यू कैन टारगेट, और you can target FMG, INICT. So for that the whole course is taken by the top educators of Unacademy platform. All 19 subject different educators are there, and also we have got more than 3-4 educators for a single subject. So study on the device of your choice, learn from India's top medical educators in this field, assess more than 25,000 high yield clinical MCQs of all 19 subjects, complete live tests and quizzes, and in the coming sessions, in the coming few months, in the coming sessions only, you will get printed notes provided if you are going to take Plus subscription of more than 1 year. So these are the benefits of Plus subscription. Be the part of this subscription. Every fourth session is a doubt clearing session. It's highly beneficial because it will give you a classroom like feeling. So we will have a classroom discussion. You can talk to the educators, you can ask the doubts while the session is going on. You will have a mentorship of the educator until the day you clear your exam. For that you have to take Plus subscription, use the code ANAT10 and get 10% discount. Now I would also like to target about iconic subscription. Students targeting next exam, NEET PG, INICT, and for FMG students also I want to tell that they should take prep ladder also. So what is there is an iconic subscription where you can get the benefits of two important subscriptions. One is the Plus subscription of Unacademy, where all the benefits of Plus subscription can be acquired by you. Again with that you will get the benefits of prep ladder. You will get printed notes of the prep ladder, by the Dream Team, Treasure 2021 Dream Notes, video lectures from Dream Team, QBank 3 with active guidance, rapid revision snapshots, and clinical and integrated sessions, essential sessions. So all these together will help you to target your dream rank, and what I suggest, go for iconic subscription, use my code ANAT10, get 10% discount, and thus subscribe for the iconic subscription. Extremely beneficial, go for it. Now after that I want to give you the information of batches starting on 18th August 2021. The batches are Focus FMG batch, Professional second year batch, Targeting University exam and next, Target Next 2023 integrated batch, NEET PG ultra fast high yield topic revision batch. These are the batches starting on 18th August. Just grab the opportunity, use my code ANAT10, get 10% discount. Now there is 1 month package also. Those who want to just give a quick revision for their exam before their NEET PG, so they can take 1 month package. Ultra fast revision batch is there, emergency room MCQ batch, NEET PG test and analysis batch is there, last 3 years NEET PG previous year batches, COVID test and grand test series, whichever you feel is important. And if you want just a quick revision, you should take 1 month subscription. Use this code ANAT10 for 10% discount. I would also like to give you information about updated highly effective QBanks. More than 25,000 high yield clinical questions based on the latest pattern of exam, includes detailed explanation made and curated by the top educators on the Unacademy platform. Use the code ANAT10 and get 10% discount. All these benefits will be given to you if you are taking Plus subscription. Use my code ANAT10 and get 10% discount. Med Genius Scholarship Test. I would like to give you the information about Med Genius Scholarship Test taking place on 14th August. The topic is number based questions. Your chance is to win either if you get rank 1, 100% scholarship for 1 year plus subscription. Till rank 4 will get 75% scholarship for the plus subscription. 5th to 9th rank will get 50% and till 19th rank will get 25% scholarship on the plus subscription. Use my code NAT10 and this test is absolutely free. So there is a chance of winning the scholarship. So just go for it. 14th August, time is 8 p.m. Don't forget, 8 p.m. is the timing. 50 MCQs are there. Grand test schedule and timetable I want to discuss. I want to show that schedule to you so that you can participate in the schedule, and these grand tests are again curated by the top educators of Unacademy platform. Go for it and be the part. Use my code NAT10 for 10% discount. Now I also suggest the students who want to crack next exam, they are in first and second year, so definitely go for 4-year subscription. Okay, so they can use either go for plus subscription or can go for iconic subscription. If you see just 1 day cost, after using my code, you get 10% discount, that is NAT10. 1 day cost is just 37 rupees for plus and 43 rupees for iconic. If you are going for 12 month subscription, you get additional 2 months of subscription absolutely free. I would also like to tell you and give you the information of the discounted rate of 1 month subscription, just 4,500. Again, by using my code NAT10, additional 10% discount means additional discount of 450 rupees. So just go for it. At the end, what I want you to see is the pricing detail. So this is the pricing detail of NEET PG subscription and iconic subscription as shown here, and this pricing detail is for 4 years, 3 years and 12 months, 6 months. So whichever suits you, go for it. If you are in first or second year, go for 3 or 4 year subscription. Otherwise, if you are in pre-finals and finals, you can get 1 or 2 years of subscription. Highly beneficial, and use my code NAT10 for getting 10% discount. All the best, students. Let's meet on the YouTube channel for upcoming session, and also on 17 and 18 on the special platform of Unacademy with the upcoming session, that is completion of 200 anatomy MCQs targeting NEET PG, and also the next integrated clinical session on Wednesday 7 p.m. and on Tuesday 6 and 7 p.m. So do lock it that we have got 6 and 7 p.m. logged for the special sessions Tuesday and Wednesday. All the best. Thank you so much. Thank you so much.